Thank you, Mark. Good morning to everyone. Nothing like talking about syphilis bright and early. I want to acknowledge the traditional territories of the Coast Salish people, and also that I have no conflicts of interest to disclose. And I'd also like to thank Olivier for putting together this panel and allowing us to have this discussion this morning. Okay, so I imagine everyone knows a little bit about syphilis, but just to start us off this morning with a few kind of facts and pieces of information around syphilis. So what is syphilis? It's a bacterial STI that can actually cause a huge array of symptoms and can actually cause long-term complications if not treated correctly. Symptoms are divided into stages, so primary, secondary, followed by latent, which is split into early and late. You can get syphilis by being exposed to a sore during vaginal or anal or oral sex, and it can also be spread from an infected mother to her unborn child. A blood test can diagnose syphilis. Some healthcare providers can also diagnose syphilis by testing fluid from a sore. Syphilis can be quite easily cured with penicillin, and the infection is one that you can get again, so you can be cured and get syphilis again. Syphilis makes it much easier to get and give HIV, and it can often be really asymptomatic, so people don't notice syphilis symptoms or know that they have syphilis. So the topic of today's short presentation is about how syphilis is on the rise. So the incidence of infectious syphilis, so primary, secondary, and early latent syphilis, has increased nearly fivefold from 2010 to 2015, and is projected to continue to rise. What I wanted to highlight was really a unique program that we have in BC, which is a centralized syphilis program. And essentially, we are able to gather information on more than 99% of all of the tests, positive tests in British Columbia. And using all of that information, we're able to follow trends over time and understand exactly what is happening with syphilis in BC. And it's something that isn't really done elsewhere. It's a very unique program. So how do we know that there is a problem? Certainly, anecdotally, we've been seeing more cases, but really what we can do is go back over time, and this slide shows you 10 years of data, and you can see that overall in the population, the middle line, the number of syphilis cases, or the incidence per 100,000 people, is increasing. But what you'll note as well that among women, there hasn't really been a noticeable increase. The increase has really been completely seen among men. Now, as an epidemiologist, how do we decide that where we have an epidemic? Well, we need to see more cases than we would expect. So certainly there's a baseline rate of syphilis that's observed. And this graph shows the 10-year average of syphilis cases. So you can see that by the end of 12 months in the blue line, there's typically about 300 cases a year. And the gray shaded line represents sort of the minimum and maximum over time. And that's cumulative cases that gather throughout the year. But the red line, which shows data last year from January till October, actually shows a really significant increase that allows us to say, okay, well, this is an epidemic. This is more than what we would expect. So I wanted to show you some information on syphilis generally in the province. So you can see this slide, you can see, shows syphilis rates by regional health authorities. And you can see increases across the different health authorities, certainly, but particularly in Fraser and Vancouver Coastal Health. If we look at syphilis rates by age, there's been an increase for age categories between the ages of 20 and 59. And the most dramatic increase has been amongst the younger groups, so between the ages of 20 to 24, which is represented by the green line. So there's been an increase among many age groups and a particularly dramatic increase among that younger group. Now, we talked a little bit about stage at the beginning. You can see in this graph that the proportion of cases, and again, this is showing 10 years of data, that the proportion of cases that are diagnosed at the latent stage or the early latent stage has been increasing over time. And this is not something we'd like to see. We'd prefer to see cases being diagnosed a little bit earlier. And finally, syphilis cases by risk group. I mean, this is a pretty dramatic slide. You can see that certainly over time, and particularly over the last period, cases among gay, bisexual, and other men who have sex with men has started to account for more than 80% of syphilis cases here in the province. So let's focus a little bit more on this particular group and look more closely at trends among gay men. So if we're looking at syphilis cases by both risk group and regional health authority, this slide really outlines for you where we can see the most cases happening in the province. And again, we can see that Vancouver Coastal and Fraser Health Authority account for many of these cases among gay men. This is an interesting slide. There's a lot happening here, so I'll go through it slowly. But if we look at syphilis cases among gay men by age and ethnicity, you can see that among Caucasian men, cases actually occur among a little bit of an older age group, whereas in non-Caucasian men, particularly in the South Asian and other Asian group, cases are happening a little bit younger. And I'll just make a quick note that we didn't have too many cases among Aboriginal gay men, so that data is based on very few cases and should be looked at more closely. We've talked a little bit in the panel so far about reinfection and co-infection with HIV, and I'll give you some of the numbers that really provide the background for these observations. So if we look at infectious syphilis notifications in gay men by HIV status in year, so again, this is about 10 years of data, and you can see that more than 50% of cases occur among gay men and represent an incredibly high proportion of co-infection. HIV positive men who are also co-infected with syphilis tend to be a little bit older, so you can see both the median and mean ages among gay men with HIV and syphilis are a little bit older than HIV negative men. And then the last piece to quickly describe is the reinfection piece. So Troy alluded to this in his talk, and I think Lauren did as well, but certainly there have been many cases of reinfection. So if we look at the number of people with 4 or more infections, we found 27 individuals over the last 10 years with 4 or more infections, and all of them were gay men, and 26 of those were HIV positive or people living with HIV. These 27 people, as we can see in the next slide, reported 805 partners, and these resulted in 127 new diagnoses of syphilis. So this really speaks to all the work that the nurses do to follow up on all of these cases. But certainly there is a scenario in which there are people who are getting repeatedly infected with syphilis. So in summary, the characteristics of recent syphilis cases appear similar to cases before 2010, but there does appear to be a core group of HIV co-infected individuals that gets infected and reinfected. Rates among younger gay men seem to be increasing, and syphilis cases among ethnic minority gay men tend to be younger and disproportionately HIV positive compared to what we see as the burden of HIV in the province of BC and among gay men. So there's certainly gaps in knowledge, and I think this is one of the reasons Troy is doing so much work, and Olivier and others, to understand some of the drivers behind this increase that we've been seeing. Certainly, as Troy alluded to, there could be seroadaptive behavior changes in sexual practices, but ultimately, even though we've been able to really conclusively observe an increase in syphilis cases, we really can't say conclusively why that has been the case. And if you think about the turn of the century, when syphilis was, rates of syphilis were going down tremendously, there was talk about elimination of syphilis. Certainly that's not the direction we're going in anymore, and really we are keen to understand why this might be the case. And there have been some testing changes, but as Troy explained, that doesn't really explain why we're seeing so many new cases. And that's certainly a trend in BC, but also in many urban centers in North America and Europe and elsewhere. So just some key takeaways. Based on the population size estimates of gay men, about 1 in 100 gay men in BC are infected with syphilis every year. 1 in 5 gay men living with HIV are infected with syphilis each year. And many of the other panelists have already spoken to some of the strategies that are being pursued, and certainly Get Checked Online was one that I also wanted to highlight as a really innovative strategy that people could use to get tested anonymously. And there's many, many people to thank, and this slide acknowledges some of those people. So thank you very much.